where it can start or when it is dispensed. Okay, so maybe from the pharmacist or from the professional, when you give a dosage, when you, example, you are going in asking about the antibiotic 500 milligram, prescription is 500 milligram, but the pharmacist give you a 1 gram, so the dose is double. So anywhere, any mistakes occurs, you follow the medication error. Okay, so if you see the prevalence, okay, how much it is the medication error. Okay, so the medication who will prescribe, who will administer hospital, then administer. Okay, you can say that 90% or 80 to 90%, who is administering? Nurse. The nurse will read and administer. So the error, we are saying that okay, the medication error remains significant issue in India. In the recent study in 2025, they are confirmed common error. That is eligible factors like non-compliance with the policy. You are not following the policies, poor handwriting, the lack of proper medication verification leading to the problem in prescribing, dispensing, administering. Okay, so here you can see the prevalence. This is the current prevalence. How much it is? The medication error still common in Indian hospital. Studies have found the rate of 45.65% overall medication error. In that, 93.33 is what? It is prescribing error. Okay, so that much error here maintained in hospital or wherever that is for near to 50% there is a medication here. Okay, so as in India, we are not that much aware. Okay, a minor error also the consumer nowadays they are becoming aware. Patients are aware. Okay, so what they can sue you on the court. Is to avoid that. Okay, you should be careful. We'll see that later. Okay, so this is the prevalence. How much medication error it is due to, and majority error is caused by the nurses, maybe a nurse or student nurse also. Okay, and main thing what majority of the error it is not come to the notice of the higher authority, but anyway it is the error. Okay, and it may harm the patient or even the patient life. Okay, so some of the news articles have taken from the majority are from Kerala, have taken some news. Okay, where the news article related to the medication here. So you can see wrong medication at the Tirunelveli. It is in 18 years old girl reported given medicine of heart element instead of prescribing rheumatic arthritis. Okay, so entering the medicine is changed. Okay. Then another one is wrong medicine to the infant. Here what happened? It is occurred in the Kano. A critical condition after the pharmacy, he dispensed the medication. Madam said, what dispense means? Okay, doctor had prescribed properly, but when it is given by the pharmacy, they have given the wrong one. Okay, so what they are given? Alleged dispense medication in drop form instead of prescribing syrup form. Okay, so the composition in the drop form, composition in the syrup form will be different. Okay, example, I say that 5 drops of paracetamol or menthol tea for the child. It may be a 50 milligram. Okay, and syrup if you take same thing, the concentration may be more. Okay, so each company will vary. So if you give for the child more, those what happen, it may damage the liver. Okay. Then next is adverse reaction to the injection. So you should be aware. Even doctors are not saying you have to ask the patient any allergy. Okay. So that is also where it may lead to the death of the patient. Okay. Packing error. Okay. Sometimes what happened? Packing error can occur. Then cough syrup concern. This was a recent one used. Okay. Cough syrup was contaminated. Okay. So these are the new articles. That means if you are taking only in Kerala, you take whole okay, in Karnataka or India, the medication error is high. So if I feel so that majority all the error is reported means maybe you have in India 90%. Okay, 90 or 80 to 90%, but majority is not reported. That's why we have a 45% of errors. Okay, so what happens if the medication error occurs? The effect of medication error. Increase in the length of stay. Example, maybe patient came with a minor problem. Okay. Because of your mistake, what happened? The patient had to he had to stay for only 3 days in the hospital. Because of your mistake, patient will stay for 15 days, 1 month. The expense all will be increased. That's the increase cost. Patient disability. Example, you take that, okay, you are given, for this first year you might be know how to give a intramuscular injection. Okay, if you want to give an intramuscular injection, you should locate different site you have. If you want to give a intramuscular injection, this is in the oil form, okay, you have to give in the noodle. Okay, so you have to avoid where you have to say insect. You have to remember divide the vertex into 4 upper outer aspect. So instead of dividing into 4 and center, we give what happens? We give injection in center. Divide the vertex into 4. In the center point, you give injection. What happens? You will damage the sciatic nerve. Patient will have one side paralysis. Got it? Okay. So why you are studying in fundamentals? Okay. What are the principal procedure in this part? You have to follow it. Okay. Instead of divide the buttocks into 4, outer aspect you have to give the injection. Or you find out there is the what pelvic curve, that iliac crest. Okay, and you have to give. So you don't know the principles, nothing. You are giving at a center. What happens? You will damage the sciatic nerve. So that's why they are saying that the patient will go for disability because of your negligence. And even sometimes oil preparation drug, which route you have to give? Which route you have to give oil preparation drug? IV? IM. Good. Okay. So oil preparation drug you should not give in intravenous. Okay. Okay, you don't know, you are given intravenously. Paracetamol, which in oil preparation you are given intravenously. It may go not the pulmonary embolism and can occurs. Okay. So you should be very clean. Okay. If you don't, you ask once again, you read the label of the medicine and you have to give. Okay. Even if you pass the death. Okay. So nurse, okay, as a professional, you should be very confident. If you have any doubt, you have to clarify with the doctors. Okay, so sometimes what happened, near miss, you can say that near miss is medication error. Medication error that took place, but the capture before reaching to the patient. Such an event has been termed as near miss. Sometimes what happened, they will withdraw the medicine, they went near to the patient. So by the time somebody had noticed and so by that it will be prevented. Okay, even that also have to be reported. Okay. Then factors contributing for medication. Yeah. Okay, so mainly three we have. Okay, that is human related, system related and medication related. Okay. So human related factors. Okay, that is provider. Okay, who is the provider? Healthcare professional. Maybe the doctors or the nurses. We are the provider. So when we will do the mistakes, okay, when we are overworked. Okay. So general ward usually I have seen one nurse for 50 patients, 45 patients. You are okay. Workload will be more. Along with that, you have recording person also. Then undertrained. Okay, so when I asked you where to give the injection, if you are not trained properly how to give the injection and give means oh, there is a problem. Okay, you should be competent now. Okay, then distracted, okay, illness, stress, all this. Patient, okay, sometimes what no, a patient will be hurried. Okay, so they will ask, where put injection, where put in discharge in the higher problem. Or something you may say that if he is in hurry, what happened, you won't check. Won't check the route, you may be that is hurry, okay, then health literacy level, do not understand the medication from patient side. Okay, trust provider, do not make the mistake. So these are the human related factors. Okay, system related factor, lack of communication, poor workflow, disorganized workspace, inadequate tool to complete the work, lack of supervision. Lack of communication means what? So you have a doubt whether it is 0.5 milligram or 5. You ask with the doctors. If the doctor is not there, call and ask. instead of giving to the patient and later there will be a complication. Okay, especially pediatric, very complicated because very minute dose they will be giving, but we won't have the same preparation. Okay, we have to do the drug calculation and we have to give. So pediatric you have micro drops. Okay, adult you have macro drops. Okay, you will give 15 drops, but micro drops very small. So you should be communicate properly and clarify with the doctors. It's not that whatever they say we have to, and any problem occurs, whom they will catch in hospital. Even though we are not our mistake, whom they will catch? Nurses only, they will catch us only. So you should be, okay, you should be very careful. Okay, poor workflow. Okay, as I said, it is then disorganized workplace. Okay, so you can say that you may have a medication scheduled at 12:30 p.m. Okay, same time you have a attendance visiting time. They will come and disturb you where it may cause the harm. So that all this and lack of supervision. Okay, so no supervisor is there for whatever they want, they will be doing. So proper supervision. You also what? If teachers are there, you will be attentive. If teachers are not there, what happens? Okay, there is a problem. Medication related as madam said, look like, sound like medications. See, some drugs, it looks both are same. Okay, sounds alike, but the actions will be different. Okay. Multiple dose form and step. Okay. So some drugs you can see 1 ml contain 50 milligram. Same other drugs 1 ml contain 100 milligram. Okay, so you have to read, you should not assume that I know this drug, 1 ml is equal to this much only. Don't assume anything. Check twice what is the dose. Okay. Okay, and you should remember all these drugs. Okay, especially when the first year also, now also you have to follow the rights, 10 rights. Okay, so right patient. Okay, so all this, whatever you are studying, you have to follow. So right patient, right track, right group, right time, right dose. This is very important. Okay, so you have whether you are giving to the right patients. How you check the right patient? Hospital. By saying ID card. Then sometimes you can see same name, two patients will be there. Okay, so I come across my specialization is in OBG. Okay, labor room, two patients with same initial it was. Okay, so Rani and initial also it was same. So we have a confusion which patient, and one patient have a eclampsia, another patient is normal same. Then what happened? We check the village from where they are came. So by the village we identify the something it happens. Okay, so that's why I'm saying right patient. Okay, even sometimes name will be same, initial will be same. So the third one some other you take, maybe a village. Okay, so father name also, but this starting word was same. Okay. Then right track, whether you are giving a right track, right route. Okay, as I said to you, you should be very keen enough to read whether it is IV or IM. Okay, subcutaneous or intramuscular. Okay, so you know how you have to give subcutaneous, how much degree you give? How much you give? Subcutaneous injections. Okay. Intramuscular? 90 degree. Okay. So if you are not maintaining the degree, what happens? It goes instead of subcutaneous, you will be giving intramuscular. Okay. So that's okay. Route and right time. Okay. Especially diabetic patients. Okay. Insulin, you have to give at the right time. When you give insulin, for example, one patient is having insulin 20 units morning. When you give morning, immediately you will give and go. How you will give? What you will see before giving? Okay, in case sheet it is given morning doses 20 unit of mixed. Nova mix. Okay, 30 units morning like that it is given. Okay, when you will give and go. You see that patient have a food with them. Okay, patient should have a food. Sometimes what happens, patient attender will be outside, the doctor's rounds is going on, they won't allow. Okay, patient will be hungry, one thing. Another thing, what? Food is not there. You are not worried. You want to finish. You have another 10 patients. You give insulin. What happens? Patient may go for hypoglycemia. Okay, hypoglycemia, seizure, and coma. So what? You have to see patient is ready. And another thing, blood glucose level have to be checked. So all this is very important. Right time. Okay, whether food is ready, glucose level you have to check. Then you have to eat. Okay, and right dose. Okay, sometimes how much dose is prescribed that. Okay, in dose, as Madam said previous presenter, you see the unit. It is milligram, gram or microgram, you have to check. And right education, right documentation, right to refuse, right to assessment and right to evaluation. This right documentation is very important. Okay, sometimes what happens, morning dose okay, will be given by the night duty sister who are morning till she was waiting, 8 o'clock. Okay, she didn't record, she is hurried to go. Okay, what happened? As it is not recorded, again the morning nurse will give the another dose. So what happened? Overdose will be there. The documentation is very important. Okay, even the patient have a right to refuse. Okay, so that is also and right to assessment and right to evaluation. So these are the rights. So only I had concentrated which is important. Okay. So I want to show this. Okay, when you administer, so simple difference will be there. Okay, so in the another picture has shown macro drops and micro drops. Okay, suppose you have a pediatric patient. Okay, so pediatric patient they are said to give 20 drops. Okay, so instead of using micro drops, that you are using a macro means what? The dose is high. You are giving 20 drops is equal to 1 ml. Okay, actually 1 ml for the pediatrics is 60 drops. Got it? So you should be aware about all this. Okay, how much you are giving. If you don't know, okay, nowadays you have a mobile with you, immediately check. You can calculate it. Okay, so that is very important when you go to the IV solutions. Okay, so here also as Madam said, the previous presenter, 1 milligram is equal to 1000 microgram. Okay, if you have a confusion with the micro and milligram, what happens? Okay, the doctors prescribed for okay, 500 milligram, microgram. You are giving milligram is what? The dose is very high. Okay, so that's why I'm saying 1 gram is equal to 1000 milligram. So this is the amoxicillin. This is 1.2 gram. 1.2 gram. Okay. So what happened? You don't know. You should know what is 1.2 gram is equal to how much okay, milligram. So that you have. Suppose doctors may be prescribed 500. Okay, you have to give a half. Okay. So minor mistakes if you make, you have confusion with the milligram and microgram. May endanger the life of the patients. Okay, types of medication error. Okay, medication error include prescribing error, dispensing error. That is once prescribed, when you dispense, when they give, they are given wrongly. Okay, documentation error, as I said you, administration error. Here, transcription error, when it is translated, okay, and intent error, when you intend itself, it is come with a different dose. Okay, so we'll see with some examples. Prescribing error. Okay, prescribing error, incorrect drug selection based on the indication and contraindication, known allergy and existing drug therapy. Here it is given example. A doctor prescribes amoxicillin to the patient with a documented penicillin allergy, leading to allergic reactions. Okay. So what happened? As Madam previous person was saying, different prescriptions will be there. Okay. So example, you take that day one, they might be given the penicillin. Okay, and you come to know the patient is allergic somewhere in the corner of the tissue they have mentioned. The another doctor may not be knowing and they have given a amoxicillin. Okay, then what happened? Allergic reaction, anaphylactic shock, then the patient may go for the ventilator. Okay, So that is the prescribing error. So without knowing the patient history properly, they have prescribed. Okay, so like this, madam already had shown the previous presenter. This is not legible. Okay, here you can see, okay, so the doctor had written 5 milligram. Okay, but here you see actually it is 0.5. Okay, so the dose is heavy. Okay, so this is the prescription what is there in my home. Okay, so my mother had an allergy. Okay, so she is having diabetic, so maybe because of the diabetic she have a allergy. As shown to the doctor, okay, so skin specialist doctor, he had written whether this prescription is correct. How you feel? Everything is clear, and he stressed me twice. Use this soap. I had written one soap. Okay, you daily ask your mother to take bath with this soap. Okay, within a week the allergy will subside. Can you find out where is the soap there? Is that soap had written? Can you find out where is the soap? First one, second one, third one. Okay, I went to pharmacy. Okay, then there I had shown the pharmacy. I said, sir, okay, because I got all that medicine. Okay, this also they had very difficulty. They called to a hospital and asked dose and all. Okay, then I said, the doctor said, what soap can I prescribe? Please see that soap. No, madam, no soap is there. Please. Okay, you find out where is the soap he prescribed. Anyway. Okay. This is the way he described. So he was breaking his head. Where is the soap? So that corner there he described it. Okay, and even we cannot read the bioskin. So what like this means pharmacists also they will assume something they will be giving. Okay, so this is not a proper prescription. So one more prescription where I got for my mother. See how clear it is. Okay, the previous presenter, madam has shown you the step, what and all should be there. So this is a computerized one. Okay, you have all the details, patient name, number, okay, injection form or what, okay, the dosage, how much they have to give, okay, and the doctor's signature, everything is there. So this is a proper doctor's prescription. It should be typed one. Okay, the previous one, how you feel? It's not clear. Okay, what he said, I had to find out where is it. So his name. Okay, so this is the proper description of that. So like this, if it is clear, there won't be that much distance. Next is dispensing error. Okay, so the dispensing error is the discrepancy between prescription and the medicine of the pharmacy delivered. As I said, no, here it will be okay. It will become okay milligram. Okay, 500 milligram. Once it go to the pharmacy, he may be giving microgram. Okay, the dose may change, trade name may change. All that may happens. Okay, so already in the previous lesson, sound alike. Some drugs, no, it looks alike, but you see that what the dosage is different. Okay, next second error is omission error. Failure to administer an order dose to the patient before the next scheduled dose. Example, nurse forgot to administer scheduled insulin dose, the next dose is delayed. Okay, so maybe delayed poor her workload or the patient didn't get the food may be delayed. Okay, so what automatically everything will be delayed. Okay, dose will be. Then wrong time error. Administration of medication outside the predefined time of interval. Okay, so here the patient's 8 a.m. blood pressure pill is given at 11 a.m. Outside facility allowed. Okay, so what happened? The what? Morning. Example, you take that morning, what time 8 a.m. they had to give. If they gave delay means what happened? Everything will be delayed. Again, the night dose also will be delayed. Okay. Then next is unauthorized drug error. Administration of medication not authorized with the legitimate prescriber. The nurse administered sedative without the valid prescription. Okay, sometimes what you do, whoever the friends you are saying, okay, somebody, okay, I'm not getting sick, you only will give a compass or some drugs you will give that may cause side effect. Okay, unauthorized drug error. Okay, next is improper dose error. Administration of dose that is greater or lesser than the amount ordered by the prescriber. Example, the pharmacist dispensed 15 milligram tablet instead of prescribing 25. How much there is a difference? 25 milligram. Okay, the overdose may can occur. Then wrong dose for form error. Okay, administer the drug product in a different form ordered by a prescriber. The patient received extended release of tablet rather than immediate release of tablet. Okay, or you have insulin, long acting insulin, short acting insulin. Okay. Okay, so usually what happens, okay, short acting insulin will be given in the morning. Okay, so human atrophy, okay, that they will give. Long acting night they will give randoms. So you forget, you are sometimes what happens, the sister will say, bed number 1, you give 30 units of insulin. Okay, so what you don't know as a student nurse, 2 glass with the water they had kept the insulin. Okay, both are insulin, you will give the long acting insulin. Okay, so there is a mistake will happen. The wrong drug preparation error. Okay, the product incorrectly formulated or manipulated before administration. The nurse reconstitute the antibiotic using the wrong dilute, altering the concentration. Okay, so usually antibiotic how you will give? Whether you dilute or like that only you give. How will you give? Like what form it will give? You have the powder form. Okay. And you have a distilled water or sterile water where you have to dilute. Okay. So, and if you are in hurry, you are taking half of this sterile water and mixing what happens. Okay, and you need only half, 500 milligram only you needed. What happens? The concentration will change. Okay, so that is the error one. Okay, find the difference. What you find out the difference here? This is a drug. This is a drug given during the labor. Pregnant mother during the delivery time will give, which may cause uterine contraction for the delivery. Okay. So doctor saying to give 5 units. Okay, give 5 units, dilute with the oral. Like that they are saying. Okay, so you have to oxytocin 10 units per ml, oxytocin 5 international per ml. Okay. How you give, which drug you give? Doctor is prescribing 5 units. Give 5 units in oral. Okay. During the delivery time, the uterus will be very sensitive. Even 1 unit of oxytocin if you give, it will start contracting. And you remember the fetus is inside the uterus. Okay. If you give the high dose, it will contract and the fetus cannot breathe. Okay. Even the death or tachycardia, bradycardia can occur to the fetus. Okay. So drug, okay, doctor saying 5 units. Okay. So same drug you see, 1 ml contain 10 international units. Same drug, another trade name, it have a 5 international unit per ml. Okay. So what happens? I am very confident. 1 ml is equal to 5 international unit, and I will give this. What happens? The dose become high. Okay. Even the rupture of uterus can occur. The uterus will contract very fast. Okay, so that's why even you know the drugs. Every time the ample will come 1 ml is equal to 5 international units. Okay, but in this case, what will happen? 1 ml contains 10 units. Okay, so you have to be. So sometimes what are the sisters what they do? 1 ml oxytocin add money original lactar like that they used to say. What you do? You won't see 10 units or 5 units. You will add with the oral. What happens? Patient have a good uterine contraction. Okay, we call it a tetanic uterine contraction, a rupture of uterus, fetal death care. So the nurses, we should be vigilant. So you see, same 1 ml have 10 units, same 1 ml have 5 units. So the concentration, you have to read the label carefully. Twice you read the label, what is that? Okay. You understand the difference. Okay, the dosage, even the dosage, the name is same, but the dosage is different. So here the corner what? 10 into 1 ampoule, that is full pack they are given. So there is a confusion. So be clear, okay, read the label one, okay, then you can go and ask sister, it is written 1 ml is equal to 10 international unit. Whether I had to give 1 ml or half ml, like that you have to see. So always don't say it ml, you see the concentration. Okay, so you can give half ml, 0.5 ml you can add for this. Okay, so the doctor prescribed 250 milligram of ampicillin IV for 8-year child. How will you administer? In hand you have a 500 ml vial. Okay, so how much for the child? 250 only is needed. You have 500. How much you will give? How much you will give? Half only you have to give. See the diluter. Okay, whether it is IM or IV, see that and dilute it. Half only you have to give. So you should not be confused. Okay, so sometimes you without half you will be hurry. You read the label. Oh, ampicillin had you. To dilute and give. What happened? Overdose will be there for the child. 500. So read the labels. Okay, twice you read and how much is needed based on. Okay, because pediatric preparation won't come. Okay, sometimes 500 will you have to give half. Even tablets also half you have to give. Okay. So this is a dilution. Okay, you can see. Okay, how much you have to dilute. So the 2 ml water, sterile water you have to give it. If it is an intramuscular, if you want IV, you have to find it. So these all things you have to be aware. You are mixing only 2 ml and giving IV means again what the vein will be damaged. Okay, so that now you should be aware how much you have to give it. Okay, so next error is deteriorated drug error. Administration of drug that has expiry or which has a chemical physical dosage. Example, insulin intended for subcutaneous injection is mistakenly given intravenously. What happened? Okay, immediate action, patient may go for the hypoglycemia. So that is. And next is monitoring error failure. Okay, so failure to review the prescribed regimen for appropriateness and detection of problem. Example, patient given insulin that has lost the potency because it was not refrigerated properly. What happened? Insulin, usually what hospital they say, 1 glass of water, put in the insulin there. Okay, or it had to be refrigerated. Sometimes even you can see vitamin D capsule, no, that it should not be exposed to sun themselves. Okay, if it is not stored properly and given, its potency won't be there. Compliance error. Okay, inappropriate patient behavior regarding the adherence to the medication. Okay, some patients you can say that they won't take the drug properly. Okay, so 1 course of antibiotic is 6 tablets is there. 3 days they have to. 2 days they will take. Symptoms is less, they won't take. Same thing you take tuberculosis patients. Okay, they have a dose dots they have. Okay, only few days they will take. The symptoms subside, they will stop. That we call as the compliance of error, adherence. The patient on nephrotoxic drug not monitored with the regular kidney function test leading to undetected renal damage. Okay, so anything, no, you have to, example, as I said, oxytocin you are given, you have to check the contraction. Insulin you are given, check the glucose level. Okay, antihypertensive they are taking, check the BP level. Based on that, the dosage will change. Other medication error, okay, so whatever we are seeing, medicine error does not fall in 1 or above. Example, patient stop taking antibiotic early, causing infections. So that is. So errors, once again I will repeat. Prescribing error, first one is prescribing error, dispensing, omission error, wrong time error, unauthorized drug error, deteriorated drug error, monitoring error, compliance error, other medication error. So now we come to the prevention. Okay, how we will prevent the medication error? Whether you have any notes? Okay, so as a student nurse also, okay, you also have to give. Okay, sometimes nurses may say, it's in charge, please give insulin to that patient. Okay, so don't, whatever they say, don't go and give it. Okay, so I will give one some example, which is real life experience what I got. Okay, so once I was there in the ward for supervision in postnatal ward. So that time what happened, some issue had occurred. So I was thinking what happened. Okay, one student was given heparin. Okay, so what happened? The staff was busy with some NAC habilitation. So she asked the student nurse, go and give the heparin to the patient number 10. What she had done, the heparin will come preloaded. Heparin will come in the pack, that means like insulin syringe. She went, where when she went, the patient of the means Rani, won't give patient number 10, Rani level. When she went and saw their indication, baby of Rani, she went and gave to the baby heparin. It is for the postnatal mother who are undergone cesarean section to prevent the complication. Prophylactically, they used to give the. She went and given to the baby. Baby condition was deteriorating. Okay, so where is the mistake? One thing, the in charge nurse made the mistake. Second thing, the student nurse had to read properly. Okay, see the case sheet. Okay, or she have a doubt who to give. She went, she gave in the thigh for the baby, newborn baby, 2 days something, and patient is planned for discharge. So nice happened, nothing happened to the baby. They immediately shifted to the NICU. Antidote for the heparin they had given. But what? The baby was there for the NICU for 1 month. All the expenditure was taken by the hospital. Okay, and I have doubt whether the mother knows this or not. It is not reported to the patient. Okay, so sometime if endanger the baby's life, what happens? Maybe for all the mother, the babies are issues. Okay, so nurses play a safety net. You can say that you are the safety net. So you have to avoid this medication here. The nurses play a critical role in preventing medication error, often serving as a safety net. So first one is adhering to the rights of the medication. So already we have said, what are the 10 rights? Right? Anyone can stand up and tell rights. Are you getting my class? Yes. Then what are the rights? One at a time. One ways to learn. Okay, so all the rights are important. Wrong site if you give, wrong dose if you give, wrong time if you give, any rights you are not following, okay, it may endanger the life of the patient. Okay, so the prescription, 7 parts of medication order are taken, so I will skip that. Okay, next prevention we can say vigilant monitoring and assessment. Okay, checking the allergy and contraindication. Okay, checking the allergy and contraindication and reviewing the patient history. So monitoring is very important. Okay. Okay, so so the nurse, as a nurse, okay, you have prescription, see that patient is have to give a paracetamol. Okay, so it is a pediatric patient. Okay, so here we have 500 milligram paracetamol and the Meftol. Both are same. Meftol for what it give? Spasm. Okay, so here different dose is there, different tablet is there. Okay, so one more example I will say that. Okay, so one patient X admitted to the medicine ward with a viral fever. Okay, and day one, okay, patient had admitted and they had given dose 650. Okay, patient got easy after taking dose 650, and the doctor had detected that dose 650 is allergic to the patient. Okay, but the dose 650 is there in the patient doctor itself. Okay, fever is not subsided. Instead of dose 650, the doctor prescribed Meftal 500. As the patient had a allergic to the Dolo 650, the doctor given Meftal 500. It has the same action. Okay, that means antipyretic, it will reduce the fever. Okay, so nurse came and reported to the doctor, doctor, the patient is having 101 degree of Fahrenheit. Okay, so doctor will say, go and give paracetamol. Okay, so the sister, what they will do? Meftal also is there. What you will say? It is for abdominal pain. Okay, so Meftal spasm is different, Meftal is different. Meftal spasm for dysmenorrhea will do. Meftal 500 is for fever. Okay, usually the patient who are allergic to the Dodo 650, they used to give Meftal. Understood? This nurse went, doctor said fever is there. She saw Meftal also is there. Okay, Dolo 60. And she started mental maybe for stomach pain, she gave the Dolo. Again, the patient got severe acute dyspnea. Okay, so he is the known case of asthma. So this will happen commonly. So you should be read the patient. Maybe somewhere it is written patient is allergic to the Meftal. So instead of Meftal, instead of paracetamol, Dolo 60 you have to give the Meftal. Okay. So you will keep on reading the case sheet, then only you come to then monitoring effect, observing and assessing the patient for therapeutic and adverse several monitoring the vital signs. Okay, so sometimes what simply whatever it is there it will be giving. So if it is subset, no need of giving. Okay, then when assessing the patient condition, this all will come under the water. Patient current health status, that means suppose you are given chronically some drug which may cause the liver damage, kidney damage, you have to see that. Then effective communication and collaboration, that is very important. Okay, so you should be assertive. As a nurse, we are not less than the doctors. Okay. Okay, so we have a rights. Here only India, little bit we are suppressed. But UK, Australia and all. Okay, they doctors used to ask us to do. Okay, so here you see, clarify the order. You have doubt in your prescription. You ask doctor what is this. You write properly. He says rightly. Okay, so you clarify and you administer. You have a doubt, milligram, microgram, point something. You ask to the doctor. Then interdisciplinary collaboration. So with the pharmacy you can discuss. Even you can say that, doctor, I know that this patient has a allergy to the penicillin. Can we change this antibiotic? You can ask them. So that is important. Then accurate handoff. That means when you are handing over the duty, properly hand over. As I said, no, morning you are given insulin, but you are not informed to the handing over system. Again they may repeat. So hand over whatever it is. This is effective communication and collaboration. Okay, then patient education and partnership. Informing the patient. Okay, so sometimes they will have more doubt. Okay, nowadays they are not asking. They will scan and you will get everything in the AI. Okay, Google will give all the information. They know everything. So better know what any procedure, what procedure you will explain the patient. That you will do it. Okay. Encourage the questions. So any questions if they want, you can clarify. Sometimes no patient question also will help us to prevent the medication here. Medication reconciliation as well. Okay, educating the patient, the families about the medicine. Okay. So otherwise what? They won't adhere to the drugs. Utilizing the technology and system researches. Okay, nowadays you have all computerized. Okay, they use the barcode. Okay, so instead of checking, so if you do the the barcode, how you what some mal and same thing medicine you have a barcode. So that will say the medication name, dosage, everything. Okay. So nurses using the barcode scanning, minimizing the distraction. Okay. So following one of the alumni of Jesus. Okay, so we called her for the conference. Okay, so that time she said that she's a nurse director, something like nurse director, and she's when she was a manager in the ward, general female ward, no medicine ward. So that time they used to get complaints, more medication error. So they were asking why your ward getting more medication error. They question. So she was keep on thinking something I had to do it to how to reduce this medication error. So what she had done, she made a apron like this. Do not disturb, drug round is in progress. Okay, so red color this one, and what happened? So she was observing in the ward. So when they give the medication, these attendants are coming and interfering and disturbing them. That may causes the medication error. So what she had done, she made like this apron. So by seeing the doctors who are wearing this, nurses wearing this, the attenders. So this happened in Australia. So by seeing this apron, they were not coming and speaking with the nurses. So and within a month, the rate of medication error was reduced. She was saying. Okay. So some we can do some research where we can reduce the. So that's it. Minimizing the distraction. By wearing this apron, or distraction will be reduced. Even you can say the patient, I'm giving medication, I will clarify your doubt afterwards. Okay. So if they are hurrying something and all, or sometimes they make a problem, all this what happen, it may distract us. Okay. Reporting the error and near miss. Okay. That's very important. So where we can bring a solution. Sometimes you are doing this, what is getting repeated medication error. So once you find out why is, most of them are fresher nurses who are not aware. So we can give some training. We can send them for some workshop where they can gain. Okay, staying informed, keeping up the up-to-date continuous education is very important. So this is utilizing the technology and system resources. Okay. So as for nurse, you will get so many ideas. So not only about studying, book and writing, when you practically do, you get so many ideas to do some research. Okay. So future when you do the higher study, from this area we can do the research. Thank you. Any doubt you have? So the miss have taken practically with the examples. Okay. Any doubt how main role is? Nurses have a role in prevention of medical error. Okay, and you should be vigilant and active. Whatever the in-charge nurses are saying, don't do. Read it and you ask question. Okay. Any questions?
Thank you so much, ma'am. Your detailed explanations, clinical clarity, and emphasis on patient safety and have greatly enriched our understanding. for sharing your expertise and guiding us towards safer and more responsible clinical practice. Thank you so much, ma'am. Now I welcome our dignitaries to present the team, ma'am.
Last year, your seniors got 100% results in pharmacology. Let me see. It's a challenge for you. Because last year we did not conduct any program like this. Pharmacology, we did not conduct any program. This year we are conducting.
Sudah itu Pak.